I want to say good morning to all of you, and I welcome you for coming here to the Ministry of Health for this special press conference. I'm Reverend Janet Michael. I'm acting on behalf of the DG for Primary Health Care, Dr. Atem, who is away for a business. This meeting, this press conference actually is supposed to highlight the issue of vaccination of COVID-19, whereby we are still having a lot of misconception, and therefore the Minister of Health is to issue a statement. And as we were waiting for the minister, we discovered the minister suddenly traveled out. The minister is not around, and the undersecretary also is not around. Therefore, such matters of importance has to be given out by the top hierarchy of the Ministry of Health. This is why it is postponed for a later day, that when the minister is around or the undersecretary, they will officially communicate to the nation of South Sudan. So I want to say thank you for coming, as you have come all in your various capacities, in your different organizations. May God bless you. Thank you.
Yes, I think this is a very good chance. You are an official director of primary health care. Around late last year, there was a measles that was declared in the country, and during that declaration, there was this. They did say that to fight that measles outbreak, they were supposed to launch a mass vaccination, and we have not had anything since then. Could you just maybe update us with regards to that?
The mass vaccination is on the way. It is going. Yes, it is true. There is a measles breakout in some of parts of our country, especially in the northern part. So that is taking place. They're working on it. But I can't give you the exact date, but I know that it is being tackled.
Why is South Sudan still talking about COVID vaccine and carrying out campaigns when we have realized that there is totally decrease of COVID issues in different countries?
Yeah, thank you for your question. It is indeed that there is a decrease in the COVID in the country, but outside there is no decrease. If you saw what happened last time in China, and you know that our people are traveling, we are not exempted from the global village. We are also part of and parcel. The issue is we still have a low level of vaccinated people. And then people are having a lot of misconception, especially our youth. People are still claiming that if you get a vaccine, you will have infertility, you will not have children. But then we know that if you are vaccinated, it actually reduces the chance of severe COVID infection. Therefore, just recently, there is a launch of doses which has been brought, and it's expected that we should vaccinate at least 1.8 million people. And this is taking a slow phase. This is why there is a need to make this press conference so that we can enlighten our people.
Yes.
How many people so far have been vaccinated?
I think our ratio is very low. I can't capture, but I think it's one of these documents that you are having. We are having, the number is not very high. According to the East African, we are the lowest. In the East African country, we are the lowest than Ethiopia, than Kenya, than Uganda. It's not much.
Some people are saying that South Sudan is having a lot of vaccines, and it's like because there is too much, that's why they are pushing for more vaccination.
No, but these vaccines have just been brought. These are new vaccines that have just been brought. Johnson & Johnson, which has been brought. It's not that they were there. If you remember, there was a launch in a Pyramid Hotel where the vice president came to talk about it. I don't know how many of you were there. Yeah.
Yeah, I would like to understand what would be the reason for the low turnout for the vaccine.
The low turnout for vaccine is the misconception which our people are having. And I had to say that especially our youth, 18 to, because when they started the vaccine, they said, oh, people above 65 and those who are vulnerable. So the youth in the middle said, we don't belong to that category. First of all, we are not sick. So a lot of them, the number is very low.
So,
And
what is your message to the South?
No, I'm not actually here today to give you. I said you wait for the minister. You see, you are now trying to give me to answer your questions.
Can you give us, apart from the issue of COVID-19, you know, the sanitation is very poor. For example, in Juba, areas of Serikat, you find there are places where there are no toilets. What's your comment on that as somebody, a medical person?
My comment on that is that sanitation is a joint responsibility. Personally, individuals' responsibility is also there. And where the government comes in and helping with the environment. But the first responsibility is individual responsibility and ensuring that I'm living in a healthy environment. That is, if I have a home, I must have a toilet. Where do I go if I don't have a toilet? This is a personal responsibility. And why do I throw the garbage just like that? I should have the responsibility to pack it in a place so that there are vehicles which are collecting rubbish, come and take it appropriately. But we are having, I call it a habit or a culture where we don't think the environment is our responsibility. That is what my personal take is. We're the one polluting the environment. If a man, a human being, does not take the dirt to throw it down, it will not be there. For example, if you take today Rwanda, Kigali, you go to Kigali, it's very clean. Why? Because they have made sure they don't throw rubbish on the ground and they pick them. But here we have a habit, if you are driving on the road, you find people opening their vehicles, whether in the bus, they are throwing bottles on the road. This is a very bad culture. So for me, it's still, we have a long way for our individual responsibility, whether we are healthy, even in our homes, whether we are looking the way how we throw rubbish.
In the medical perspectives, what type of
In the medical perspectives, I want to say it is very dangerous because as the rain begins, we are going to have waterborne diseases, airborne diseases, pneumonia, cough, malaria is also will be increasing, and special diarrheal diseases are going to come on, which includes also cholera. So, thank you, because the water is polluted.
Your name and your role.
I'm Reverend Janet Michael. I'm the Director General for Nursing and Midwifery Services, Acting Director General for Primary Health Care Services.
Thank you very much.
Thank you so much.
Yeah.